Kidney conditions are very critical for any patient or their family members. And they are not just common condition, but they are very devastating for life. If you talk about Indian scenario, almost 800 to 900 people among every 10 lakh people, they are suffering from some or other kind of chronic kidney disease. And the severity of the chronic condition is that almost one-fourth of those patients, that is almost 200 people among those 10 lakh population, they suffer from end-stage renal disease. So this is the very severe condition. And if your family member, if you are suffering from this condition, then this tutorial is for you. Do not miss this episode because today we have a very special guest with us, Dr. Siddharam Kamte. He is an expert nephrologist from Hubli and Dharwad area. He has managed various kidney related patients and their conditions in this area, and they are doing very well. So I welcome you, Dr. Siddharam Kamte, to today's episode.
Hello, Dr. Nitin. Thanks for inviting. Yes, you can
Yeah.
start.
So, Dr. Kamte, you are already managing this kidney patient, and we would like to
Yeah,
learn more from you about this chronic kidney condition disease. So, can you tell us what is this chronic kidney disease?
yeah. Chronic kidney disease, also known as CKD in short term. So it is the one disease in which the the condition wherein the kidney slowly and gradually reduces its function, structure as well as function. So it is not in a days or weeks. It starts in a months to years. So CKD, again there are stages are there in CKD 1 to 5 based on the GFR. GFR is nothing but the calculated value from the serum creatinine. Serum creatinine is the test what we do, which we do normally in all labs. From your creatinine increases, say of more than 1.5, along with your the structure of kidney, like the kidneys will become shrunken, then and you develop protein in the urine. That means you are developing slowly chronic kidney disease. So this is a brief about chronic kidney disease, and it is not reversible. So it is irreversible state. So ಇದು ಪೂರ್ತಿಯಾಗಿ ನಾರ್ಮಲ್ ಆಗಲ್ಲ. ಸೊ ಇದು ಪರ್ಮನೆಂಟ್ ಆಗಿ ಸ್ಲೋಲಿ ಕಿಡ್ನಿ ಡ್ಯಾಮೇಜ್ ಆಗುತ್ತಾ ಹೋಗುತ್ತೆ.
So, Doctor, as you mentioned, it's a like chronic condition and it's developing very slowly. Can you tell us, like, are there any common causes which can lead to this kind of situation, or they can cause chronic kidney disease?
Common causes of chronic kidney disease in India as well as in the whole world is diabetes mellitus. That is, in Kannada, it is called as Madhumeha Roga, diabetes, sugar. So that is the most commonest cause. So out of 100 CKD patients, at least 40 to 50% of CKD is due to diabetes mellitus. So second commonest cause is hypertension. That is in Kannada, it is Adhika Raktadottada, hypertension. In late term, it's called as blood pressure. So around 20 to 30% of cases are due to hypertension, second most commonest cause. Third commonest cause is glomerular disease. Glomerulus is a one unit in the kidney where it filters and helps in the toxin removal. If that is involved, that's known as glomerular disease causing CKD. And other rare causes are like vasculitis, some immunological problems like SLE, antiphospholipid antibody syndrome, and anti-GBM disease. So that will also lead to CKD. And rarest causes like cases with AKI, that is temporary kidney failure, which will not resolve they'll also go into CKD, like in patient with snake bite, that is how ಕಡಿದ್ಮೇಲೆ ಕಿಡ್ನಿ ಫೇಲಿಯರ್ ಆಗುತ್ತಲ್ಲ, ಅದು ಕೂಡ ಕ್ರಾನಿಕ್ ಕಿಡ್ನಿ ಡಿಸೀಸ್ ಆಗಿ ಬರ್ಬೋದು. ಸೊ ಇವೆಲ್ಲ ಮೇನ್ ಕಾಸಸ್ ಆಫ್ CKD ಅಂತ ಹೇಳಿ. ಇನ್ನೊಂದು ಇಂಡಿಯನ್ ಸಿನಾರಿಯೋದಲ್ಲಿ ಹೇಳ್ಬೇಕಂತಂದ್ರೆ, ಇಂಡಿಯಾನಲ್ಲಿ ಸೊ ಕಾಮನೆಸ್ಟ್ ಅದರ್ ಕಾಸಸ್ ಆರ್ ಲೈಕ್ ಪೇನ್ ಕಿಲ್ಲರ್ಸ್. ನಾವು ಈಗ ಮೆಡಿಕಲ್ ಶಾಪ್ಗೆ ಹೋಗಿ ಪೇನ್ ಕಿಲ್ಲರ್ಸ್ ತಗೋತಾರೆ ಜನ ವಿದೌಟ್ ಪ್ರಿಸ್ಕ್ರಿಪ್ಷನ್. ಸೊ ಅದು ಹಳ್ಳಿಯಲ್ಲಿ ಬಹಳ ಕಾಮನ್, ಈವನ್ ಶಹರ್ನಲ್ಲೂ ಆಗುತ್ತೆ. ಸೊ ಅದರಿಂದ ಪೇನ್ ಕಿಲ್ಲರ್ಸ್ ವಿದೌಟ್ ಪ್ರಿಸ್ಕ್ರಿಪ್ಷನ್ ತಗೊಂಡು ಕಿಡ್ನಿ ಫೇಲ್ಯೂರ್ ಆಗುತ್ತೆ. ಸೊ ಸೊ ದೀಸ್ ಆರ್ ದ ಕಾಮನೆಸ್ಟ್ ಕಾಸಸ್ ಆಫ್ ಕಿಡ್ನಿ ಫೇಲ್ಯೂರ್.
So, Doctor, you have mentioned variety of reasons that are causing or that are leading to chronic kidney diseases. So, can you tell us or guide us what is actually happening behind the scene? I mean, what is happening inside the kidney? Why does this chronic disease occur in the kidney?
So this happens because as I said, the commonest causes are like long-standing diabetes, hypertension, and all. If your sugars are not under control, or if your blood pressure is not under control, slowly what happens, these are the systemic disease. Systemic disease means it will not stay to one system. So almost all systems are affected in the body because of all this diabetes, hypertension. In diabetes and hypertension, what happens as the disease progresses, say around 5 years, 10 years, 15 years of diabetes or hypertension, slowly what happens inside the kidney, the nephrons, that is the structural and functional unit of kidney, it initially overworks. It try to overwork because it try to prevent kidney from going into failure. So that overwork, that called as hyperfiltration, that only initially it is a compensatory mechanism, but as the kidney disease progresses, that hyperfiltration itself will damage the kidney, and over a period of 10 years, 12 years, 15 years, so they'll end up in kidney disease. So this happens in both diabetes, hypertension, as well as in other diseases also. And the proteinuria is the culprit. Proteinuria means protein in the urine. So in initial part, the protein will be less, that is less than 30 mg. So but as the disease progresses, it increases to 300 mg, 3 grams, like that. So that times it will become irreversible disease. ಕನ್ನಡದಲ್ಲಿ ಹೇಳ್ಬೇಕಂತಂದ್ರೆ ಒಳಗಡೆ ನೆಫ್ರಾನ್ಸ್ ಅಂತ ಇರ್ತವೆ. ಆ ನೆಫ್ರಾನ್ಸ್ ಹೆಂಗೆ ಅಂದ್ರೆ, ಆಸ್ ಶುಗರ್, BP ಹೆಂಗ್ ಜಾಸ್ತಿ ಡ್ಯೂರೇಷನ್ ಜಾಸ್ತಿ ಹಾಕೊಂತ ಹೋದಂಗೆ ಅದ್ರ ಸ್ಟ್ರಕ್ಚರ್ ಮತ್ತೆ ಅದ್ರ ಫಂಕ್ಷನ್ ಸ್ಲೋಲಿ ಕಡಿಮೆ ಹಾಕೊಂತ ಹೋದಂಗೆ ಯೂರಿನ್ ನಲ್ಲಿ ಪ್ರೋಟೀನ್ ಲೀಕ್ ಆಗುತ್ತೆ. ಆಮೇಲೆ ಫೈನಲಿ ಕಿಡ್ನಿ ಸಣ್ಣದಾಗಿ ಕಿಡ್ನಿ ಡಿಸೀಸ್ ಸ್ಟಾರ್ಟ್ ಆಗಿ ಡಯಾಲಿಸಿಸ್ಗೆ ಹೋಗ್ತಾರೆ. So that's about the how kidneys are affected.
Okay. So, Doctor, as you mentioned, it's taking too much time, like almost 10 to 15 years to develop this kind of chronic condition. And while this is happening, are there any symptoms which can be like patient can identify during this period, or it happens, or the symptoms appear only after the damage has been occurred?
Yeah, it is a good question. Symptoms like unlike in heart disease where you have chest pain, breathlessness, but in kidney disease there are 100 of symptoms. So no symptom is specific to kidney. They'll develop headache due to rise in blood pressure. They'll develop blurred of vision due to rise in blood pressure in CKD, and they might develop nausea, vomiting, reduced appetite, that is less eating, not feeling okay, generalized weakness, and and bone pain. You develop pain all over the joints, pain in the all over the body, and leg swelling, that is the lower limb swelling, and reduce urine output. And sometimes the other symptoms are like the change in color of the urine. You might develop change in color of urine, the And these are the various symptoms. So in Kannada, we can say, I can tell that the ಈ ಕಿಡ್ನಿ ಸಿಂಪ್ಟಮ್, ಕಿಡ್ನಿ CKDಗೆ ಒಂದೇ ತರಹದ ಯಾವುದು ಸಿಂಪ್ಟಮ್ಸ್ ಇರಲ್ಲ. ಅದರಲ್ಲಿ ಸುಸ್ತಾಗುವುದು, ರಕ್ತಹೀನತೆ, ಕೈಕಾಲಿನಲ್ಲಿ ಬಾವು ಬರುವುದು, ಆ, ಮೂತ್ರದ ಮೂತ್ರದ ಪ್ರಮಾಣ ಕಡಿಮೆ ಆಗುವುದು, ಉಸಿರಾಟದ ಸಮಸ್ಯೆ, ಎದೆನೋವು, ತಲೆನೋವು. ಸೊ ಈ ತರ ವೇರಿಯಸ್ ಸಿಂಪ್ಟಮ್ಸ್. ಆಮೇಲೆ ವಾಂತಿ ಆಗೋದು, ಹೊಟ್ಟೆ ಹಸಿದೇ ಇರುವುದು, ತೂಕ ಕಡಿಮೆ ಆಗೋದು. ಸೊ ಇದೆಲ್ಲದೂ ಕಿಡ್ನಿ ಸಿಂಪ್ಟಮ್ಸ್ ಅಂತ ಹೇಳ್ಬೋದು. ಸೊ ನೋ ಒಂದೇ ಸಿಂಪ್ಟಮ್ಸ್ ಇರಲ್ಲ ಕಿಡ್ನಿಗೆ. ಅದಕ್ಕೆ ಇಟ್ ಈಸ್ ವೆರಿ ಡಿಫಿಕಲ್ಟ್ ಟು ಡಯಾಗ್ನೋಸ್ ಇನಿಷಿಯಲಿ.
Okay. So doctor, tell me, like whenever this patient develop this kind of chronic kidney disease and they want to take some kind of treatment, so what are the treatment options available for chronic kidney disease, and how do you manage your patients?
Yeah. So once that CKD is diagnosed, that is, as I said, there are 5 stages, CKD 1 to 5. So if the GFR, I said it's based on the creatinine value. If the GFR starts dropping less than 60, so it means CKD stage set in. So the initial stages, the commonest the treatment or prevention will be treat your blood pressure as well as hypertension, blood pressure and diabetes. So if you treat adequately blood pressure and diabetes, you can progress that you can delay the progression of the CKD. What I meant is, if you are not controlling your hypertension and sugar, that is diabetes, so the kidneys which are already damaged started in initial stage, that will go on progressing and it will go into end stage renal disease. So the main crux of treatment in CKD is control your blood pressure and diabetes in initial stages. And the second is consult your nephrologist monthly on a regular basis, so that he'll change the medications, he'll advise you diet changes and all. So diet is the next most important treatment aspect, according to your habitus, according to your where you are living, and according to the summer, according to the season wise also, the diet changes. So your nephrologist will be a good guide to guide you for the changes in diet. So diet plus treatment plus regular exercise. So exercise means not only going to gym and all, you regular exercise, say 30 minutes brisk walk per day for at least 5 days a week, so that it helps the kidneys to prevent going into end stage renal disease and dialysis. And there are various medicines to delay the progression of CKD. Nowadays, they are into market. So they are good drugs. Say about 50 to 70% patients, the creatinine will be stabilized. Out of and rest 30%, 20 to 30%, there are doubtful values. And if you have some habits like smoking and tobacco chewing and alcohol, so you have to quit everything, and the drink adequate amount of water. And if you have any renal stones, that is the another cause for CKD, manage kidney stones, and prevent going into end stage renal disease. So in Kannada, if I want to summarize, ನಿಮಗೆ ಬ್ಲಡ್ ಪ್ರೆಷರ್ ಶುಗರ್ ಇದ್ದಲ್ಲಿ ಮೇನ್ ಅದನ್ನ ಟ್ರೀಟ್ಮೆಂಟ್ ತಗೋಬೇಕು. ಕಿಡ್ನಿ ಸ್ಟೋನ್, ನಿಮ್ಗೆ ಪದೇ ಪದೇ ಕಿಡ್ನಿ ಸ್ಟೋನ್ ಆಗ್ತಾ ಇದೆ ಅಂತಂದ್ರೆ ಕಿಡ್ನಿ ಸ್ಟೋನ್ ನ ಟ್ರೀಟ್ಮೆಂಟ್ ತಗೋಬೇಕು. ಆಮೇಲೆ ನೀವು ಸ್ಮೋಕ್ ಮಾಡ್ತಾ ಇದ್ರ, ಅಥವಾ ಆಲ್ಕೋಹಾಲಿಕ್ ಇದ್ದೀರಾ, ಅಥವಾ ಟೊಬ್ಯಾಕೋ ತಿಂತೀರಾ, ಗುಟ್ಕಾ ಎಲ್ಲ ತಿಂತಿದ್ರ, ಅದನ್ನ ತ್ಯಜಿಸ್ಬೇಕು. ರೆಗ್ಯುಲರ್ ಎಕ್ಸರ್ಸೈಸ್ ಅಟ್ಲೀಸ್ಟ್ 5 days a week ಮಾಡಬೇಕು. ಆಮೇಲೆ ನಿಮ್ಮ ನೆಫ್ರಾಲಜಿಸ್ಟ್ ಅಂದ್ರೆ ಕಿಡ್ನಿ ಡಾಕ್ಟರ್, ಮೂತ್ರಪಿಂಡ ತಜ್ಞರಿಗೆ ಮಂತ್ಲಿ ಒನ್ಸ್ ವಿಸಿಟ್ ಮಾಡ್ಬೇಕು. ಸೊ ಇದೆಲ್ಲ ಮಾಡೋದ್ರಿಂದ ವಿ ಕ್ಯಾನ್ ಪ್ರಿವೆಂಟ್, ಅಂದ್ರೆ ನಾವು ಡಯಾಲಿಸಿಸ್ ಅನ್ನ ದೂರ ಮಾಡ್ಬೋದು. ಕಂಪ್ಲೀಟ್ ಆಗಿ ಸ್ಟಾಪ್ ಮಾಡೋಕ್ಕಾಗಲ್ಲ. ಅಟ್ಲೀಸ್ಟ್ 3 ವರ್ಷನಲ್ಲಿ 4 ವರ್ಷ ಡಯಾಲಿಸಿಸ್ ನಲ್ಲಿ ಸ್ಟಾರ್ಟ್ ಆಗೋದ್ರಿಂದ ಅಟ್ಲೀಸ್ಟ್ ನಾವು ಪೋಸ್ಟ್ಪೋನ್ ಮಾಡ್ಬೋದು, ಸೇ ಅರೌಂಡ್ 5 to 6 years. So this is how about the treatment of prevention. And another, if you go into dialysis, suppose you are you reach CKD stage 5, and there are other options for treatment like hemodialysis, that is the blood from your body uh, will go into the machine, that is dialysis machine, and it is purified, and the pure blood is returned to your body. That will take weekly 2 to 3 times. And another modality is peritoneal dialysis. Peritoneal dialysis means they'll put a catheter in your abdomen, and fluid is being pushed, around 2 liter fluid will be pushed inside, and the you have to keep that fluid in the abdomen for around 4 to 6 hours, as suggested by your nephrologist. Then you drain the fluid. This peritoneal dialysis you can do at home. So the third modality is renal transplantation, kidney transplantation. That is the gold standard treatment for CKD patient. Again, in the kidney transplant, there are two types. One is cadaver transplant, one is live related transplant. Cadaver means patients getting admitted in hospitals with head injury or any road traffic accidents. So if you are listed according to your state wise, there is again the different societies will be there. Like in Karnataka, we have Jiva Sarthake. If you register there, if you are having kidney disease, you register, and when your turn comes, the suppose you are B positive, when your turn come, that time you have to go to hospital. They'll call you, and that time you can get transplant. That is a cadaver transplant. Next is live transplant. Live transplant is either your mother or father or spouse, either husband or wife, or a brother, sister, whoever blood group and other cross match, everything matches, then they can give a kidney. And so that is called as live transplant. So this is briefly about the treatment.
Okay. So, okay. So that is very nice, doctor. Thank you for elaborately talking about the various preventive tips and lifestyle modifications to prevent this chronic condition. And also you have very nicely and easily explained us about the treatment options. So, like, doctor, in my observation, what has been seen is that many patients who develop this kind of chronic kidney disease, they get kind of tired of the treatment and they stop taking treatment, or or maybe due to some other reasons they stop following the treatment. So can you tell, for clarity of those patients, what could be the complications if they do not continue the treatment, particularly the patients who are already into late stage, or maybe the patients who haven't developed any critical symptoms. So do you have any suggestions or guidelines for this kind of patients and their family members?
Yeah, that is a good question. That this such practical. This is a practical question. Such patients we see regularly here, because CKD is not a one-day disease. It is a lifelong disease, both financially and emotionally. Uh, Both patient as well as the family members will be suffered in this disease. What happens is, if you reach CKD end stage, that is CKD stage 5, or started dialysis, if your nephrologist advised dialysis weekly 2 times, so you have to continue weekly 2 times. What happens if you do weekly once, or some patient we are seeing here, they do once in 10 days, 15 days. In them, what happens is, as kidneys are not functioning properly, the slowly the toxicities build up inside the body, like urea, creatinine, and all. And some and potassium, that is the very dangerous for heart. So as the potassium crosses at least around 5.5 milliequivalent, slowly it start affecting the heart, muscles, and in general body. So once they miss dialysis, they might go into generalized weakness. They'll develop lower limb swelling, and they'll develop breathlessness, chest pain, and headache, and rise in blood pressure. And ultimately, if potassium crosses 6 and all, they might go into sudden cardiac death. They might die of heart attack. So 90% of deaths in chronic kidney disease patient who are on dialysis or not on dialysis is due to cardiac involvement only. So ultimately, heart is the one which is affected in such patient who are not following regularly and who are not undergoing dialysis regularly. So another other complications are if you are miss the follow up and if your blood pressure keeps on increasing. So 150 160 is the regular blood pressure in CKD patient. So if you are misses antihypertensive, misses BP medicines, miss the follow up, what happens is they might go into complications of hypertension like brain hemorrhage and acute coronary syndrome, that is heart attack, or they might develop sudden breathlessness and they might go into ventilator and ICU admission. So this is the brief about the complications and this thing. And if I want to say in Kannada, briefly, I'll say that ನಿಮ್ಮ ಡಾಕ್ಟರ್ಸ್ ನಿಮಗೆ ಡಯಾಲಿಸಿಸ್ ಬೇಕಾಗಿದೆ ವಾರಕ್ಕೆ 2 ಸತಿ ಅಥವಾ ವಾರಕ್ಕೆ 3 ಸತಿ, ಆಮೇಲೆ ನೀವು ಅದನ್ನ ಬರಲಿಲ್ಲ ಅಂತಂದ್ರೆ ನಿಮ್ಮ ಬಾಡಿನಲ್ಲಿ ಪೊಟ್ಯಾಷಿಯಂ ಜಾಸ್ತಿ ಆಗುತ್ತೆ, ಆಮೇಲೆ ಮೈಯಲ್ಲಿ ನೀರು ಜಾಸ್ತಿ ತುಂಬಿಕೊಳ್ಳುತ್ತೆ, ಉಸಿರಾಟಕ್ಕೆ ಸಮಸ್ಯೆ ಆಗುತ್ತೆ, ಎದೆನೋ ಬರುತ್ತೆ, ಆಮೇಲೆ ಬ್ಲಡ್ ಪ್ರೆಷರ್ ಕಂಟ್ರೋಲ್ ಮಾಡ್ಕೊಳಕ್ಕಾಗಲ್ಲ ಅಂದ್ರೆ ನಿಮಗೆ ಫಿಟ್ಸ್ ಬರ್ಬೋದು, ಆಮೇಲೆ ಸ್ಟ್ರೋಕ್ ಆಗ್ಬೋದು, ಬ್ರೈನ್ ನಲ್ಲಿ ಹೆಮರೇಜ್ ಆಗ್ಬೋದು, ಸಡನ್ ಹಾರ್ಟ್ ಅಟ್ಯಾಕ್ ಆಗ್ಬೋದು. ಸೊ ಇದೆಲ್ಲ ಕಾಂಪ್ಲಿಕೇಶನ್ಸ್. ಸೊ ಇದೆಲ್ಲ ಕಾಂಪ್ಲಿಕೇಶನ್ಸ್ ಪ್ರಿವೆಂಟ್ ಮಾಡ್ಬೇಕಂದ್ರೆ ನೀವು ರೆಗ್ಯುಲರ್ ಆಗಿ ನಿಮ್ ವೈದ್ಯರ ಹತ್ರ ಹೋಗಿ ಅವರು ಕೊಟ್ಟಿದ್ದ ಮೆಡಿಸಿನ್ಸ್ ಮತ್ತೆ ರೆಗ್ಯುಲರ್ ಡಯಾಲಿಸಿಸ್ ಇತ್ತಂದ್ರೆ ಡಯಾಲಿಸಿಸ್ನೇ ಮಾಡ್ಕೊಂತ ಇರ್ಬೇಕಂತ ಹೇಳಕ್ ಇಚ್ಛೆ ಪಡ್ತೇನೆ. ದಟ್ಸ್ ಇಟ್ ಫಾರ್ ಕಾಂಪ್ಲಿಕೇಶನ್ಸ್.
Thank you very much, Doctor, for clarifying and providing your practical insights and your experience. I hope the audience of this video will be definitely be benefited by watching this video. And if you are somebody who is watching this video till now, I request you to, like, if you or your family member is suffering from any diabetes, any blood pressure, or maybe you have some history, family history of any kidney disease. So I request you to please visit and like consult the nephrologist, the kidney expert doctor nearby you. And if you are somebody from Hubli and Dharwad area, please do visit Dr. Kamate. The details of contact details of doctor will be provided below this video. You can visit him and consult with him for any like blood pressure related conditions or any diabetes or kidney related problem, so that he can guide you, so that you do not develop this kind of complication and you delay any complications happening due to this kidney disease, because your life is precious. And not only that, it is not only precious for you, but for your family members also. So not for only your good health, but for wellness of your whole family, please do always consult with a nephrologist for customized and personalized guidance from the doctor. So that's all for now. Maybe we'll visit in another tutorial with another expert doctor on another topic. So that's all for now. This is Dr. Nitin signing out.